Okay, everybody, this is the first class. It's on that lab, that first lab date. The weeks start official the next week, but this is the first class, which is the date of January 20th. And we're going to talk about the importance of stories in this class. We're going to talk about the class itself and how we use stories when we use stories in this class to kind of think of your patient kind of as a story. Here's kind of our quote for the week. Kind of gets at what we're trying to get at this week. You can never really fully understand a person until you consider things from his or her point of view, until you climb into their skin, his or her skin, and walk around in it. This famous painting here of the doctor, definitely a story within that painting. We'll get into that as we kind of move along here. Again, we're going to go over the course on this lab lecture. I'll talk about what empathy means, how it's related to this class, stories in this class, looking at patients as three stories, start to tackle that, and start to tackle something called the real assessment. You may have had some of this already with Emily, I'm not sure. Something you've been doing for your capstones, and you've been doing a lot of it in this class. This is kind of a way of breaking down a patient really quickly and easily to get at their story, so you can make the most effective treatment plan, ideally. Okay, in each week we'll be doing exercises. There's a separate PowerPoint on the exercises. And we'll keep doing these Tai Chi ones for the first 4 weeks until you have those down pat. And just an added resource tool in your belt, so to speak, for when you go out in your clinicals this summer. Today's questions. So some of these exact questions or multiple choice questions related to these exact questions will be on the midterm exam. So you want to make sure you get the answers to all these questions. Once you're done with this lecture, definitely let me know if you're unsure, uncertain about any of the answers for any of these kind of questions. How is empathy defined? Why is it important in healthcare? Why is it important to understand a patient's story and to think of them as a story? What kind of occupational therapists are most effective with clients? What does the REAL stand for? And how do we kind of define those patients, those three stories for each patient? This class is really about two different things. It's about giving you all those practical hands-on skills that you're going to need for your level 2s this summer. And it's also giving you another skill, I think, which is just as essential, this idea of being able to understand your clients, kind of see things how they see them. It's not so much about your opinion or your point of view in the world. It's not so much about changing how you see things. It's about just trying to understand where the person is coming from. We'll get a lot of that with the stories we're getting into, this idea of what stories are about, these books that you're going to be reading, all this idea of just kind of understanding how the patient sees the world, not so much you or your opinion, but how they see the world. A lot of creative kind of things, making adaptive equipment in this kind of class. Big assignment coming up in this class is this movie, Crip Camp. It's a documentary. It's on Netflix. We have to get some temporary services for Netflix if you don't already have it. Pretty cheap either way. There are some movies you need to watch in this class. This is one of them. And this taping, I'm not going to go through the syllabus. Definitely go through it if you're unable to make that first lecture class, so that we can you can come to me with any questions about any assignments, that sort of thing. The book assignment, definitely stop in and pick out your book. That's all articulated in the modules in Canvas. Doing practicums in this class. We're doing what we call home health practicums with a simulated apartment over on Marshall Road. You're out there for some IPEs, I think. There's a little old lady's apartment in there. There'll be an OT, in most cases, simulating a patient. You'll be going in there in teams of 2 and 3, assessing that patient. Very, very realistic. Students have said it's even more realistic than what you've done in the past with Katie's, with the hospital sims over on campus there in the Wellness Center. Doing 2 of those. They're all outlined in the Canvas modules. If you want to try to get an idea what those are about, those start in February with the first team. A lot of great evidence behind power of these simulations, the power of these practicums. We know, and I definitely know, they're not fun to go through. They can be very stressful and challenging, but they're really a good thing. Really help you get ready for the summer, make that transition to the clinic that much smoother and kind of easier. And then speaking of evidence, what this class is taught, it's kind of like 300, really all my classes, very hands-on-y, very real-life experience kind of thing. And the evidence shows with teaching that the more I talk, the less you actually take in terms of the lecture. And reading textbooks, you don't really, students don't really retain a lot of that. But if you're doing stuff, you're doing a practicum with a patient that's close to the real thing, you're building something. You're building an adaptive device. Our maker lab in this class, we're making adaptive devices. Experiencing it emotionally, which is the idea of the stories. All the stories will be in this class. The movies and the documentaries and the TED Talks. Much more real, again, and the professor sitting up in front of you talking about it. And it seems to really work in terms of students retaining and learning a lot more. Obviously, especially when you're getting you ready for what's going to be happening this summer with you. Okay, one of the first things we're going to kind of look at, and kind of a cornerstone of this class, this idea of empathy, having empathy for your patients. Again, that's that skill of kind of seeing it as they see it, not so much how you see it. So you kind of have to get away from how you see the world and really kind of see it as it's kind of they see it. And it's really important for us to do this, especially as OTs, to kind of get away from some of that medicalized viewing of the person as just like this anatomical machine that has a defect that we're trying to fix, kind of thing. Definitely have to have some thinking in that, especially when we get in the upper extremity in terms of anatomy and stuff. But you always have to keep in mind it's a human being. It's not just a collection of parts, mechanical parts. It's a human being with a lot of complexities to it and a view of the world from their life experience. Empathy. How do we define empathy? Simply, it's understanding the perspective and the emotions of another. Empathy and health outcomes. This is studies on clinicians, therapists, occupational therapists, physical therapists, doctors, nurses, social workers. Those who are more empathetic, have that skill of understanding their patient versus those who are not. This is judged by the patients themselves. What's the connection between them and health outcomes? Pretty overwhelming. Clinicians, healthcare workers, therapists that are more empathetic or caring for their patients get better faster. They use less services, they get so much better outcomes. Overwhelming evidence with the effects of empathy and compassion on patient outcomes, decreased cost, decreased burnout, all those great things. It's clear as hand washing. The evidence is just so overwhelming strong. They're strong now, they've done a lot more studies on this. The more empathetic you are as a therapist, the more effective you are. In particular with OTs, if you see we'll get more into this in a minute, but if you see your client as kind of this unfolding story, seeing your patient as a story versus just a list of problems, you're going to get better outcomes, you're going to be more skilled. Patients really respond to therapists that care about them, that demonstrate that caring, that empathy. And these stories, seeing your patients as a story, again, a big theme for this class, it really is a kind of a window into being empathetic with your patients and being the most effective therapist that you can be in terms of getting the best outcomes. That's really kind of the bottom line with this. Can you understand all the different things that are going on with the client? If you think that's an easy thing to do, you're probably not really understanding it or they haven't given it much thought, because it can be very, very hard, especially for some patients. They can be hard to relate to, or they have this really complicated life story, so to speak. Looking at their context, their culture, kind of withholding judgment. Again, it's not about your view, your opinion of them. It's about your understanding of how they see things. Kind of slipping out of yourself and into them. If you look at this picture, there's a name for these kind of pictures, but this is kind of a picture we have to kind of see it in a different dimension. Obviously, it's trees here, but if you look at this picture closer, you get to the point where you can see a beautiful woman's face. Here's her eyes, lips, nose. Here's a curve of her jaw line, and even her hair a little bit. And you kind of help this patient kind of see this future vision of health, which is really the key with a lot of the stuff we'll get into. healthcare really is a land of stories. Every patient has a story to them. And they really almost kind of like in between stories. They've had the story of where they were before they came to the hospital, and the story of them in this kind of emergency crisis kind of mode. This is where you have to come in, we have to listen, not acknowledge, hear their stories closely, and ideally, the kind of the bottom line, help them kind of reinvent themselves in some case, and recreate that story of what they can kind of become. And again, it's a different way of thinking, kind of moving from a two-dimensional, three-dimensional thinking, really seeing this person as a full, complicated human being, versus just a list of problems in a chart. Magdalene Fleming, two famous OTs, actually they're anthropologists. They decided they wanted to study occupational therapy to see how OTs think, from an anthropological perspective. And they quickly found that they focused their study on stories. These OTs seem to really ask for the story from their patients and kind of work and think and internalize through stories. Kind of how the OTs kind of thought and reasons what they found in their study. And they did, like, when you think about anthropological study, they kind of immerse themselves. You classically think of the anthropologist out in the jungle immersing themselves, with a tribe. In this case, the tribe was the OTs, and they kind of lived with these OTs for over a year, I think it was. And what they found is that these expert OTs, the ones that are most effective, they use stories a lot. They use stories to locate their patients in kind of past and future stories, kind of where they were and where they need to go. These expert OTs, and so we want you to be an expert OT as much as we can, kind of going into the summer. Very flexible in your thinking, kind of remaking that story to get the patient where they need to go. Very skilled at seeing the patient as part of a bigger whole versus being kind of reduced to the range of motion of their elbow. What do they need that elbow for, what to do? Kind of avoid that chart-driven kind of thinking. Emphasize this larger, unfolding patient narrative of story or stories that kind of regain their health. Expert occupational therapists use this perspective story making to see the big picture and the story of where their patient needs to go. These expert OTs have a sense of an ending, where the goals, again, where everything kind of is leading towards a larger life story, and this is a connection to past life experiences. So they built off the person's past. They didn't ignore it. They saw all this as part of where the person needed to go. And this process was very co-creation. In other words, it was client-centered. The client and the OT working together to understand where the person was and where they want to go. This kind of fostered joint meaning-making, constant flexibility, constant remaking, very dynamic process, not very kind of black and white, linear kind of thing. So if you look at this painting, this is a painting story of the doctor by, I can't remember the guy's name. It's a famous painting. If you look at this painting, it has a story in it. And kind of thinking in stories is going to get that skill that you'll need in this class, kind of moving forward for a lot of different parts. If you look at this picture, this being the patient, this young girl here, what is her past, present, and future story? And this painting tells a story. Think about that for a second. How would you say, what was her story before she got sick? What is her story now? And what is the potential kind of future story for her? So if you think about it, to me it's pretty obvious just looking at this picture. She's very sick. It's like her mom and dad are very distraught. And there's the doctor trying to think of a way to help her, to heal her. So as a young girl, you think past story, she was healthy, running around, playing. Present story, she's very sick with some kind of illness, very much in a state of crisis, limbo. Future story, in her case, would be getting back to things she loves to do, playing, playing with her doll, or whatever it was that she loved to do. That's that past, before the sickness, present, in the sickness, future story, where they want to need to go. Very simplified version of something that can get quite complex. Okay, so what we're going to do now is that class activity. If you read that story that's in there, what is the name of the story? don't know off the top of my head. I think it's healing. So read that. If you haven't done it, read that story. I'm going to break it down into this past, present, and most importantly, the future story of health for this person.